Welcome everyone. This is Dr. Debleena Bhattacharya, Associate Editor for InnoHEALTH Magazine. So today our interview, we have an eminent persona whose diverse expertise carved a unique niche to his personality. We welcome Dr. Jagdish Chaturvedi. He is an ENT surgeon trained at St. John's Medical College and Hospital, Bangalore, and a Stanford Indian Biodesign Fellow 2012, and holds an MBA degree in entrepreneurship and hospital management. He has co-invented and developed 18 affordable medical devices addressing the unmet needs in the healthcare system. He is currently the founder of and CEO of HIIH Innovations Private Limited. He is also associated with Fortis Hospital, Bangalore, as a consultant in the field of ENT. He is recognized as one of the 35 innovators under the age of 35 by the MIT Technology Review 2016. Apart from all these achievements, he is also a stand-up comedian with a YouTube channel by his name. He also has authored a book, Inventing Medical Devices, A Perspective from India. So with so many accolades and diverse aspects of profession, let's welcome our guest, Dr. Jagdish Chaturvedi. Sir.
Thank you so much for having me here. I really appreciate it, and happy to be a part of this interview with InnoHEALTH.
We will start with the questions, sir.
Sure.
Okay. So being a surgeon, innovator, and also a stand-up comedian, it represents three diverse aspects of the same person. What has inspired you to be part of all of them with equal enthusiasm?
Yeah, so I think for me, they are not different things. I have had a lifestyle since a child. So even when I was a kid, I think almost from the age of 7 years, I have always been into theater. I've been doing plays for all my life. And a lot of us do that. We are all a part of a theater club or a dance club or, some sports academy or something like that. The only difference is by around 8th or 9th or 10th, when our exams and education takes the priorities, these things take the back seat. The only thing that I did is I continued them all the way into my clinical practice time. So through my MBBS college as well as my post-graduation college, I used to be constantly involved in theater. So for me, these three things, being a surgeon was primary, always wanted to be a doctor. So I think that was the career choice that I took. But being an innovator and a stand-up comedian were evolutionary outcomes of the circumstances I was facing. So for me as a doctor, I feel for a doctor to invent is an extension of what a doctor should do. Because while I was seeing patients, there were many times where I was not able to offer any good solution to the patients. And being the front end, talking to the patient and not being able to offer solutions. Like, for example, we are examining people with throat cancer in rural areas. We're not able to see, we're not able to biopsy, we're not able to examine. And then we have to say that, this is all that we can do. And I was very not comfortable saying something like that. So I felt as a doctor, you don't only have to see patients or contribute to research, but you should also enable care for patients. And for that reason, I believe that every doctor should invent, because doctors understand the core problems. And what I did in trying to invent early on during my post-graduation itself was merely just an extension of what I felt I should do as a doctor, because I was unable to provide the best care. But as my clinical practice grew, theater started taking a bit of a hit, because theater requires many months of rehearsals and a huge team and a lot of commitment. While it was fine till I was studying, because your academic calendar is not very unpredictable. But when I started practicing as a private practicing doctor, you can have patients anytime in the day. You can have surgeries, emergencies anytime in the day. And I was unable to make time for these rehearsals. And I ended up being that actor who would commit but not be there for the rehearsals. The whole team suffers. And I would get the main roles, but I would not do all of these rehearsals. And then, I was almost blacklisted from many theater groups. So stand-up comedy at that point of time in 2015 was growing to be a field where you get to be on stage, you get to be someone, you get to do comedy, or you get to play a character. But stand-up comedy interestingly takes away the need for rehearsals with a group, because stand-up comedy is a solo job. Though you need a team, but you don't need to rehearse with the team, like theater demands. You can write it in your own time, you can practice it in your own time, you can perform it, and you can improve your art. And that suited well with my clinical role and the innovation arm that was growing. And that's why being a surgeon, innovator, and a stand-up comedian ended up being somewhat an evolutionary balance that I had to do, to be able to keep my passion alive, and as well be an effective doctor, and a holistic doctor.
That was interesting, sir. That was really very interesting and really appreciable things.
Thank you.
After the COVID-19 phase, is there any change in the scenario of stand-up comedians?
Yes, actually, yeah. So COVID-19, when the pandemic started, it was a big hit for live shows. I was almost doing about an average 10 to 12 shows a month. And largely corporate shows, medical conferences, college shows, and also for schools. So when the pandemic hit, all the live shows completely got stopped, and then we were to adapt to a newer form of comedy, which is virtual. Now, what happened is the dynamics changed drastically, because when you are performing live, your competition is only the comedians who are in that city. When you are performing virtually, you are competing with every comedian in the world, because anybody can also perform live at the same time. So suddenly, for medical conferences or for organizers, their options widened. But at the same time, the options widened for the audience also. First, they could only go and see shows that were there in the city. Now they can attend any comedian anywhere. That was one aspect that changed a lot of the dynamics for stand-up comedy. The second aspect was to perform virtually, which is very difficult in a field of comedy, because live audience cannot mute itself, or a live audience cannot suddenly disappear. And then the live audience is all in one room. You can control that room, you can control the energy of that room, you can build the energy in that room. Here everyone is sitting in their own independent rooms, where there are different energies, there are different distractions, and they can get a call, they can mute, they can disappear. And that took some time, especially for many comedians stopped doing stand-up comedy because of the pandemic, because they could not adjust to virtual shows. For me, on the other hand, coming from a theater background, and having a lot of experience with people, was able to somehow figure out some nuances to make that work. And in fact, I started doing more virtual shows, more virtual stand-up comedy than I was doing live, because now there is no travel element, and you can do multiple shows in a day. Like I remember at one day I did about 9 shows in a day. And that used to be something that I would probably do in a month, because it's just from one Zoom link to the other, or a Microsoft Team link to other, and with a gap of 1 or 2 hours, and you have a new audience on your screen. And in this pandemic, I've done over 200 shows, just virtually, though it does not give you the feeling of an actual live audience. But I think now we are able to get as close as possible, because now we know what to do, what to say, what to ensure that the audience gives the same flavor. And if you see any of the virtual stand-up comedies that I have conducted recently, they're just as good as live in terms of the reactions and laughs, claps, and applauses. But the only thing is that you're not there in one room, and you still have to see each other's faces next to each other. But having said that, I think it has helped artists grow, and artists who could hustle and survive the pandemic figured out ways to survive. It also eliminated the weak. So the survival of the fittest holds true even for comedians. And now I think we have better comedians who have a lot of content, and they can make people laugh, whether they're in front of them or very far away as well.
So that was a whole lot of new experience then.
Yes, absolutely. A lot of new experience, a lot of new learning, a lot of new growth, and definitely kept my time useful throughout the pandemic as well. Even though online consultations also took off with probably, if not same, but much more stronger, growth curve.
Yeah, now it has changed. The whole dynamics have changed now for the online aspect. So,
Yes.
from an Indian perspective, what are the hurdles you have faced while following your passion as well as profession?
Yeah, honestly, I did not really face many hurdles from this balancing act, especially from my family. So my father's a psychiatrist, mother's a teacher, and my father has also been an actor while doing his medicine. So art has always been encouraged. I grew up in Bangalore, and Bangalore has very strong theater roots, especially at school level. Uh, Most people from Bangalore are usually a part of some of the other theater or dance group, even at a professional level. And I was just like everyone else. So for me to be studying and following my passion really has never been a big hurdle for my parents. They were not the kinds who said that you can follow your passion later, focus on your studies. I think when we tried that, though, at some important aspects of our, studying life, my performance came down whenever I would not take part in certain extracurricular activities. And I think my parents were soon to realize that that's an important part of my well-being, both mentally as well as in my outcomes. So, from my immediate family, never have had any hurdles. As a professional, there were some hurdles, but that didn't seem to bother me because, as generally, when you're an artist, you're used to criticism much earlier on, and you're used to improvising also a lot. So even though I had colleagues or professors or teachers who would say things like, "Hey, you're a surgeon or you're inventing. You wasted a medical seat," because they assume that inventing is a totally different thing, and being a doctor is a totally different thing. So they feel that, okay, if you're inventing, you stop becoming a doctor. Or if you're doing comedy, my colleagues would say, yeah, you're as long as you're doing theater, it's fine. Theater has got some elegance to it, but you're doing comedy, to joker ke paas kaun patient aayega? Like, why will a patient come to a
Yeah.
joker?
Mhm.
What is the perspective there? So I got to face that early on. I don't get that at all anymore. In fact, I get the same doctors now wanting to invent, and also same colleagues wanting to try out comedy. But early on, I did have that, because whenever you do something offbeat, whenever you do something that is not the norm, people who have been hustling with those same questions in their mind, but they have chosen their profession, will also question you, because that's probably why they didn't do what they wanted. So they ask you also, why are you doing like this? But for someone like me, see, I'm not a topper. I don't have very high stakes. I'm an average kid, and I try a lot, I fail a lot, and I cope up a lot. So for me, it's not very disturbing to hear things like this. In fact, it kind of gives me a direction that, okay, if I'm going offbeat, that means there'll be less competition here, and I'll be able to create a space for myself. And now when I look back at it, I ask my patients, why do you come to a joker? And my patients say that, sir, when you did comedy and we connected to your joke, we feel we've connected with you at a human level, and you're less likely to cheat us. Otherwise, this image of doctors, especially in the corporate world, that want to trick you to surgeries and want to take your money, we feel that you are probably not the kind of person, because we've already connected beforehand. And that's a very interesting insight, because my patient flow almost doubled or tripled as some of my comedy picked up. And not only that, post my comedy sessions, people would line up. I thought they were taking selfies, and then until they take out their CT scans and start showing me their sinuses. And my surgeries also increased. And similarly, with the medical community, being an innovator, I now get a chance to work in many other fields, even though I'm an ENT, but my inventions and the inventions I've supported are across various clinical fields. So I think holistically, these hurdles have made me probably a doctor with wider knowledge and experience, and an artist with wider knowledge and experience.
That's great. So actually, you took a road less traveled by then.
Yes, road less traveled, and also laid the tar for it, I guess.
Yes. So the next question is pertaining to the recent pandemic. It has taught us a lot. Kindly share any anecdotes that you would love to share with our readers that have motivated your thoughts.
Yeah, so the recent pandemic, one of the things that it was doing to me as a doctor
Mhm.
uh, was that people remotely wanted to seek care, but being in a surgical field, it's very hard to provide definitive care. Like I had a patient from Raipur who wanted to travel to Bangalore, for a consultation, but because of the pandemic, the patient could not, and I was not able to do anything beyond a video call. And patient had issues in the ear, but I could not see inside the ear. So I was, trying to guess and wasn't sure whether it will worsen and all of that. And that made me think that we need to find a way to make tele-examination happen now, because teleconsultation may work very well for things like radiology, pathology, or many medicine fields where there are chronic non-communicable diseases, where you can do a set of lab tests. You can get basic parameters like pulse rate, BP, temperature. Many of these devices are there at homes of people, even oxygen saturation for that matter. So a lot of these parameters are easily accessible. So for those fields, it works. But for surgical fields like mine, if you do not see inside the ear, nose, or the throat, there is not much that you can do in your diagnosis and in your treatment. So now what we have done, and that is what the pandemic has taught us, is that we have now developed a technology where we are now able to remotely carry out examinations. So I just recently saw the same patient from Raipur by sending a device to their house, and they were able to place that device into their ear. They were able to place a device into their nose, in their oral cavity. I could see the images very clearly sitting here in Bangalore on my computer, and I was able to make a diagnosis and treatment for them. And now we're looking at doing this in a larger way. But that's definitely something that the pandemic has taught and has motivated me and my team to think about living with the current situations where patients are scared to come to the hospital. Patients may not be even permitted to travel many times. And vulnerable patients like kids, older people may not find it safe to visit contagious areas like hospitals. And for a surgeon, if you're not able to examine, you will not be able to treat them. And I think tele-examination is going to be the future for a lot of surgical fields, to be able to do the workup entirely offline and see the patient directly in the pre-operative area, operate the patient, send them back, and then again follow up remotely. And that's a big realization, and we've been able to motivate ourselves and do something about it.
Yeah, so it has taught a lot, because now we can see, and this virtual this thing has happened during the pandemic, and due to this, lots of those who cannot come or afford, they can at least get the proper medicines and all the facilities now.
Yes, absolutely. And also workup for surgeries. Everyone's not always immediately fit. Yeah. But if you do the right diagnosis and right follow-ups, you can work up the patients. You can have better documentation of their findings from medical legal perspectives also. And you can directly plan the surgery and call the patient only for the least exposure during the surgery.
So being an innovator, if you can reminisce about any Jugaad technology used for any of your innovations, how was the experience?
Yeah, so see, Jugaad it is a part of the process of making an actual product. Jugaad is what we would call in an innovation lingo, we would call it the first prototype or an alpha prototype or a proof of concept.
Yes.
Jugaad is not at any point of time a final product. The Jugaad is a quick fix where you prove your concept and show that it works. So it may not have the shape and form. We may be using some existing products or components or some quick mends that you have made, and you're able to achieve the outcome. So I think we do Jugaad in every invention that I have worked on. Our first step is to Jugaad, and that's called a proof of concept, is to create something using existing tools without spending much money, without spending much time, and see whether this is working. We don't try this on patients, but we try the concept, whether it is able to give a certain outcome, whether it's a mechanical, device that is producing certain pressure or producing certain temperature, or it is maneuvering in certain ways. Those kind of things are done by Jugaad. My first innovation where I was not experienced in inventing and I was not trained in any of the trainings that I've got. I've been trained by Stanford University through a India-Stanford partnership called Stanford India Biodesign. We now do a lot of this Jugaad very formally. But earlier, my first experience with Jugaad was when I was trying to make a portable laryngoscope. I wanted to see inside the throat, but I wanted to see it portably. And this was back in 2008. So at that point of time, we had digital cameras, handheld cameras, like your Sony Coolpix or any of those. Phones were not that advanced as they are today. But my first jugaad was basically taping a laryngoscope, video laryngoscope to the lens of the camera and seeing whether the same image is coming onto the screen. And, by taking another light source, like a portable light source, and fixing it. And I was able to perform endoscopies using that, because what's going inside the patient is still the laryngoscope, only the recording system was a jugaad. And I think when you do the jugaad, when you make that first prototype, that's when you start learning about what it needs to be in terms of the improved product. It tells you a lot about what you're doing right and what needs improvement. And it is the right way to invent. It's not like you have to get on a drawing board and think of the final perfect product and only make that. You have to go through these iterations of making proof of concepts, then a refined prototype, then an even more refined prototype, and you have to keep testing in between till you are able to fix all the errors, make it a safe device, and then take it for clinical trials. So I think as an innovator, I feel jugaad and developing jugaad technology is a very integral first step for any innovation.
Yes. So can you give a brief description of any of your innovations and how it has benefited the community or the patients?
Yeah. So, but before that, I would like to make it clear that not every invention I've worked on has been successful. Initially, I used to say I have developed 3 products or 4 products. And my teacher and guru, Dr. Ravi Nair, who kind of coached me into innovation, said, Jagdish, you're not giving the right picture. I said, but sir, I have only developed 4 products that are working. He's like, yeah, but how many did you try to work on? And these 4 are the only ones that have survived. You are giving the message that any device you develop is successful. And then I started coming up with this statement where I would say, I worked on 12 devices and 5 are in the market. And today I have worked on about 20 devices and 10 are in the market, to show that there is a 50% failure when you come to inventions. So out of the 10 devices or 10 technologies that I've developed that are in the market, if I have to list some of them, then the first one, of course, is the ENT endoscopy device that I was talking about, in the previous answer. And this device was, developed in 2008, but it took us a lot of time to refine it and bring it to the market. In fact, it took almost until 2014 for a large medical device company called Medtronic to license out the device. And today it is what is called as an Shruti InnoHEALTH program. The device is called IntraView. So Shruti InnoHEALTH is their screening device that it is now used for. And I believe close to about I think 500 or 600,000 patients in rural parts of India have been screened with IntraView, and many hundreds of health workers have got jobs through the screening platform. And so that is definitely one of the early technologies, and that has reached a massive number of people in terms of impact. The other couple of devices that I'm an inventor of, but as an inventor, what I would do is I would find the right engineering and design teams and then spin off startup companies and then remain a clinical advisor. So with that, there is a device called SAS. You may have heard of it. It gets a lot of media coverage. It's a mechanical CPAP device. So one of the original inventors, along with a team of, I think, 12 inventors who are a part of that technology. But I think SAS and SAS Pro have really impacted not only pediatric transportation while maintaining the positive airway pressure in the lungs, but also in COVID, it is, help patients who are having dropping oxygen saturations and, providing them with the right pressures. And there's another device called WAPCare, which we also have a US patent for. I'm one of the original inventors, but there's another team that's developing it and has brought it to commercialization. This reduces a very crucial problem of ventilator-associated pneumonia by ensuring that oropharyngeal secretions and subglottic secretions are automatically cleared out without much neck movement, without much need for nursing, intervention, so that less of the secretions aspirate into the lungs and cause pneumonia. Because the number of patients who are on ventilators have a very high chance of getting into a ventilator. So the other devices in the ENT space that we've made is a simple one is a nasal foreign body removal, which is commercially available. It's already there in many medical colleges and hospitals in rural areas, which is a single, simple, handheld, affordable device to remove anything impacted in a child's nose from a non-ENT expert. So any general practitioner, MBBS doctor, pediatrician who gets a child with a foreign body in the nose, where they don't have any tool, they have to use makeshift tools. Now we have a dedicated tool with a light source, with a handle, with a grip, and with a unique mechanical design that can remove it in the first attempt. We have doctors putting videos of their first attempt removals on YouTube, and many children are now avoided from having to undergo surgeries, undergo anesthesia, undergo endoscopic procedures, or have risk of aspiration into their lungs, because now the first point of care, the foreign bodies can be removed accurately. Some of the other devices which are used very actively, I've developed a balloon sinuplasty system. Balloon sinuplasties are not novel devices. They already exist, but they're not so much in India because the cost that, Western technologies, when they develop products, they price it based on their buyers. Most of the times people who pay for these technologies are insurance companies. So they are exorbitantly high priced. India is a out-of-pocket paying market. So it didn't make sense when some of these balloon sinuplasty devices came into India, namely Johnson & Johnson's Acclarent system was charged almost 3 times more than a very thorough FES procedure, which you do for sinuses. So it doesn't make sense here. A patient will be like, to put a balloon into my sinuses and do those procedures repeatedly, I might as well pay 1/3 and get a definitive FES surgery. And for that reason, it didn't work. But we were able to reverse the economics here by making the balloon sinuplasty device less than 1/3 the cost of the FES surgery, so that in the OPD or as an office procedure, people with early sinusitis can get a balloon dilation and reverse their sinus issues. And if they still, not recovering, or their medications are not helping, or there are other anatomical complications, then they can undergo a FES surgery. But at least we avoid unnecessary FES in a large number of people, and we avoid progression of disease. 1 in 8 Indians suffer from sinusitis, and many of them can be provided non-invasive, minimally invasive, very quick, management earlier on. Similarly, there is this, pressing problem of tinnitus and eustachian tube issues, very common in India because of the turbinate enlargements and blockages of the eustachian tube. And we have developed a balloon that can dilate the eustachian tubes. And I do both these procedures quite actively. And it's always overwhelming to use your own invention in your own practice that benefits your own patients. Some of the others that we licensed out very quickly were simple thoracocentesis devices, abdominal paracentesis device, accurate nasogastric insertion tube. Were taken over by a company called McMahon Health in Delhi, and they are now distributing and manufacturing it both India and internationally. We also developed a liver biopsy device, which is now developed under this company called Indio Labs. The product is called BioScoop, and that claims to do ultrasound-based needle aspiration biopsy without causing any bleeding, which is a big problem because when you have liver disease, your intrahepatic bleeding is very high when you take true-cut biopsies. So these were to list, out of the many devices that I've been a part of, but these are the ones that have, reached the patient over a span of 3 to 5 years for development of each technology.
It was wonderful. So with this, we will conclude our today's interview. So thank you, Dr. Jagdish. It was really an insightful journey of a surgeon, innovator, and stand-up comedian. So it reminds me of a quote that was said by Michael Eisner, that is, diversity is a great force towards creativity. And your work truly, it shows that with so many diverse professions, you have also managed your passion along with your profession. So thank you very much for this interview. And it is really an insightful journey that you have covered till now, and hope to see more inventions from your side. And now the research has come up and doctors are actively participating in research. So we get to see a lot more research papers also coming out.
Yes, absolutely. Thank you very much. And I think I would like to leave with this small message that, like you're saying, more doctors are coming up with research and more doctors are coming up with their ideas, but they're not finding the right teams.
Yes, yes.
My latest startup, HIIH, is
Yeah,
basically an app that you can download and it's free to use, and it helps you connect with different people within your city who can help you with your inventions by being a part of it. So a doctor can find an engineer can find a doctor, you can find a scientist, lawyer, product developer, anything, and that's absolutely free to use. And that's a solution that we have created that will help doctors find it easier to find teams and develop their own technologies.
that's great. That's great.
All
So,
right.
so thank you so much, sir. So we will be then wrapping up this session for today.